muted.
Okay.
Okay.
I think we're live. We got a couple minutes yet, so we'll just chat a little bit until 12 o'clock Mountain Standard Time, when everybody starts to come online. Yeah, so as I mentioned, Jeff and Tina, you look pretty color coordinated today.
Yeah, we didn't plan that.
Totally by accident.
No.
Oh, come on. You do that every day, right? You gotta wear same outfits.
Look over somebody's
Monday, Tuesday, Wednesday outfits.
What day is it? During this crisis, I always forget what day it is. I don't know if you guys are like that, but
yeah, I saw a social post yesterday, and you know how it would normally say Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. It said day.
Yeah.
Well, the one thing that I have quickly realized during this crisis and being at home so much is I know exactly how many yoga pants and sweatpants I have.
I'm just realizing how comfortable it is to live in them.
It's true. It's true. Like today, you know, obviously doing webinar, I got up, you know, put makeup on for you guys, did my hair. Actually put adult clothes, you know, yeah.
Right.
Yeah.
So 11:59 for those of you who are arriving. We're just waiting until 12. We've got you know, another minute or so to go. So yeah.
You know what I discovered that I'm so excited about?
What?
There are a whole bunch of games you can play online. And I don't mean like video games. I mean like real games. So playing euchre, playing Pictionary, playing code names. Like so we've been having virtual parties and
yeah. Hey, 265 people are already online.
Oh, wow.
That's awesome.
Play Pictionary.
That's right.
Hey, well, look at everybody's coming in. Oh, Mylene, hello. Natalie from Montreal.
That's pretty cool.
Everybody, yeah.
That's very cool.
You know, as we start to get going, it's 12 o'clock. You put comments in the comment field. We see them, and we'll get to answers as soon as possible. Okay. So welcome, everybody. 12 o'clock, we're going to get started. You know, we did these last week. I feel like we're getting pretty good at them. Very popular. People really want to know what's going on these days. We've got some great panelists. I'm going to introduce them in a minute. I want to start by welcoming everybody and thank you for taking the time to come on to this, you know, discussion today. And really, you know, this is a great topic because as a marketing agency, we are getting inundated right now with just, you know, how do I manage my business during this time? And a lot of it is, you know, how can I get online? How can I potentially sell my products? And, you know, I think this is forcing people to really look at, you know, what are my options? So we have a great panel today that's really going to discuss, you know, what they're currently doing and, you know, what you can potentially do. So first off, I'm Trudy Sheree, if you don't know me. I'm one of the co-founders of Marketing for ECPs. We're a digital marketing agency focused in the eye care world. And, you know, definitely, you know, want to be there to help people understand what they can do today. And that's part of the reason for putting on some of these webinars and really, you know, finding those solutions for people right now. So I'm just going to mention our panel, but I'm going to let them talk a little bit about themselves. So corner is Dr. QQ. Next corner is Kelly Goodhue, Kelly Curry. And then we also have Dr. Crow at the bottom. So I'm actually going to pass it right over to you guys and let you talk a little bit about yourselves. So we're going to start with Kim.
Hi, I'm Kim Crow, and I'm one of the owners of Downtown Vision Care, which is located right in downtown Calgary. We have, you know, dispensing, and we have a large contact lens practice. There's 3 doctors in the office every day, and usually we have 13 staff. And yeah, and we're happy to be been using Sightly for a while.
Great. Well, we're going to move over to Jeff and Tina.
I'm Tina Goodhue, and this is Jeff Goodhue, also known as Gina. We practice in Oakville, Ontario, and we've had a practice there for about 15 years. It's called Abbey Eye Care. We have 3 associates, and like him, we have about 3 doctors on per day. If you'd asked me a month ago, I thought I was set to retire in about 10 years. Now, unfortunately, I think it's closer to 15. But thankfully, we have a great profession, and I really do like my job. So.
Jeff, are you going to say anything about yourself?
Nope.
No? Okay.
All done.
So then we're on to you, Kelly. Tell us a little bit about you.
Yeah, my name's Kelly. I'm the founder of Get Sightly. It's an e-commerce platform for optometrists. We actually started it back in 2018. Lucky to work with Jeff from the beginning, and Kim and her crew. And it's been amazing, the outreach, really overwhelming, that we've seen in the last couple of, I'd say about the last 10 days for the platform. So yeah, it's been an amazing journey. I didn't think that we kind of see the uptake that we're getting right now. Thanks to yourself, thanks to Kim, Jeff and Tina, and then obviously all the other partners that we have. It's been phenomenal.
Yeah, I bet you're busy.
Yeah, it's busy. It's busy.
Just a little bit of extra interest for you these days, hey? Well, before you guys dive into the actual e-commerce topic today, I'd love to hear a little bit of what's going on in your world and how you guys are doing right now. So we'll go the back route, and we'll start with you, Kelly. So we kind of already said you're probably pretty busy.
Yeah, it's been amazing. Really from all the partners, from yourself and your company, and Jeff and Tina, just really everybody, just the influx of demo requests and wanting to see the platform. Yeah, I mean, it's really hard to describe because it's something that I've never experienced for in my business career. Just the velocity that the requests have come in, so much so that we even had to reach out to Microsoft. So our platform is hosted on the Azure platform, and they've actually helped us create some tools so that we can spin up storefronts quicker than what we're doing. So yeah, it's been amazing, and we just hope that we knew that it provided value. It certainly has been our message since 2018. But when you see a situation like this where we could be closed for another 2 weeks, we could be closed for another 4 weeks, and then what happens to your business when behavior? If we thought behavior was e-commerce before, behavior is e-commerce now. Telehealth is the behavior that's been set, and those will be, to me, those will be the two big pieces of software when we come out of this. Whether it's Sightly or whatever that e-commerce type platform is. So the one things that we talk about in our demos, if this extends in a period of time, and everybody thinks that they have to go online to order their products, focused optometric products, what is the potential of business loss? Because what you're up against technology to try and get those customers back, because now they've experienced the ease and convenience. We've seen what the brands are doing, where they're doing ship to home now for all of the products. And so even though those things are good, if you don't have, in my opinion, if you don't have any technology to kind of take advantage of that, what happens and what does this look like when we come out of this? And so that's what we talk about. So whether it's this pandemic or certainly going forward, if you have products, you're going to have to, in my opinion, again, have to have some sort of e-commerce type solution, because you're going to have those buckets of patients that this is their preferred method to consume items, whether it's from you or whatever. And I think Jeff, and especially Kim, Kim's clinic is number one on the platform by far. And so, they can, she can attest that more than I do. But again, it's just, maybe sometimes it's nice when you're not an optometrist and you kind of get to look at it a little bit differently with a different set of glasses, if you so to speak. But that's what we think. It's, if you don't have something, there's a real potential when we come out of this, because behaviors will have been changed so drastically when it comes to going to the store or purchasing items, whatever the case may be.
I totally agree. I mean, I think we keep talking about it and hearing about it in the fact that the new normal is going to be very different than the old normal.
And this isn't the first super bug we're going to face. You know, we've had a great lesson on how. I mean, to me, it's amazing. You know, outside of e-commerce, just the ingenuity that we've seen to help the medical professionals when it comes to all these types of things. But this isn't our first super bug, so. I think the lessons that we learn now, we better make sure that we apply those going forward, because this might be just a little wave to a tsunami we might get at some point in the future.
Agreed. Jeff and Tina, what's it like in your world right now? What are you guys going through?
So I guess we're way busier than I ever anticipated. As business owners, there's a lot to shutting down your clinic, to notifying your patients. That's a ton of work, and then responding to patients as they reach out to you by the different channels that you've set up. But it's also given us a bit of time to do some sort of stuff that's been on our to-do list forever, like clean up the office, revamp our internal marketing. Big project is to connect our EMR to the ophthalmic lens companies. So when we enter an order, click a button, it gets sent directly to the lab. And then what does the world look like when we reopen? Setting up policies and procedures around what things will look like, in a month, roughly, when we hopefully reopen.
Yeah, I think it's going to be quite different. And you're right. What businesses are going through right now is a lot of work. It's not like you're just sitting at home doing nothing. Kim, tell us a little bit about what it's like at Downtown Vision these days.
I think just the same as what Jeff was saying, that it just seems to have been so busy just dealing with all the information, everything changing so quickly, trying to help patients out as best we can, trying to run the office without our staff being there right now. We've had to learn a lot and try to get all those things set in place. And we're still learning, and we're still doing that. But I think it does, it's just easier just trying to really focus on taking it just day by day. Just focusing on what we can do today and what we know today. So we're just trying to do that and just help out our patients as best we can.
Great. I'm going to start directing some of these questions a little bit. So I'm going to start by directing actually to the doctors. So any of you can answer this one. I'd love to hear what is kind of happening with the patient behavior right now. Have they gone silent? Are you hearing from them? Are they emailing? Are they texting you? Like, what is happening with patient behavior right now?
I can take that, Trudy, if you'd like. So at the very beginning of this crisis, we actually set up a banner on our homepage that directs patients to a dedicated COVID-19 page. And on that COVID-19 page, we actually spelled out how we want our patients to reach out to us. If they have glasses inquiries, we want that to go to our general inbox. If they have patient care or urgent care inquiries, we have them fill out an online triage form that's going directly to the doctor they normally see. If they have contact lens inquiries or dry eye product inquiries, then we send them to our web store. We've also still been answering the phone and checking our emails. We've, at this point, just kept one staff person on to help us get through this period of time.
And you, Kim?
I think, very similar to Jeff and Tina. We're mostly, we're still answering the phone. We're still in the office a few hours answering the phone and asking patients to contact us by email if they can. And I think that we are kind of surprised we haven't had as many patients contact us with eye emergencies. I don't know if other people are noticing that. Usually we have, quite a few patients a day, and maybe it's just because we're downtown and people are contacting offices that are closer to where they live. But we have been a bit surprised by that. We have had lots of inquiries about, if you're closed, can I still get contact lenses? People panicking about that. But we are surprised that we haven't had as many emergency people contact us for emergencies.
Yeah, it's interesting, because obviously we're talking to optometrists across North America. And some are actually quite busy with emergencies. Some are, you know, we've had some say they were booked solid with 8 emergencies in a day. And feeling that they were really helping because those emergencies would have ended up in the ER right now, and not wanting to obviously plug up ER with something that we can look after. So, yeah, it's all over the board, but I have heard, you know, that it's been quiet. So patients are thinking you're closed, or they're just cocooning right now at home, so they're not reaching out yet. So it is interesting. We're hearing a little bit different all over. So thank you for that. I think you guys kind of answered a few of the questions already, but, you know, I was going to ask you, how are you reaching out to people? You know, you guys answered a few of those, and, you know, I know that you're utilizing your social media really well. Is there one most effective way that you're finding to reach out to patients right now?
So I would say, I mean, we did a bulk email when we closed, sent it out to our entire patient database. And what we were also going to do is scrape our database and look at patients who need to reorder their contact lenses. So maybe pick a date, say from January, extend it out to end of April, early May. Grab those patients that we know are going to need to reorder their contact lenses, and be proactive and let them know we've got an e-commerce platform. Send them the link to our Get Sightly store. And we'll also scrape our database and maybe pick patients who have ordered dry eye products over the past 12 months and send them an email as well. Say, hey, you know, these are drops we recommended. You really like them. You can still purchase them from us via our online store.
Yeah, and we've done the same thing as well. We sent a mass email to all of our patients, letting them know about the office closure and how to contact us if they have an emergency or would like to order contacts. And I think we're planning to do the same thing with exactly what Jeff was saying about with our contact lens patients who are due to reorder in the next couple months. And we're planning to send that out. Hopefully we'll get that out next week to them. And just directing them again to our website and to our link on our website to order directly.
And, you know, I think it's important, you know, that we look at what the strategy is, and we'll chat a little bit about it closer to the end of what's a strategy, first and foremost, to get them to your e-commerce stores, which we'll get you guys to chat about. But in this time is to stay in communication with the patients, what you're doing, and things are changing almost daily these days. And so what you can still offer and you know, what you're there to help them out with. So let's dive into the e-commerce and start chatting about that. So we're going to start with Kelly and get him to kind of set the stage for what we're going to talk about today, and a little bit about you and your background and your vision, and, you know, both Get Sightly and what you're doing.
Yeah, well, where it really started, if you want to go way, way back, I was actually on Dragon's Den for the audition in 2009. I actually created a golf training aid and was fortunate enough. Thank God it didn't make television because it was not a good audition. But from that came this training aid, and we ended up doing an infomercial, and Hank Haney endorsed the product. He was coaching Tiger at the time. And through that, to support the infomercial, I created, you know, this e-commerce platform. And unfortunately, when things happened with Tiger and the Golf Channel sold the infomercial business, you're just kind of sitting here, well, what do we do next? And the natural pivot was obviously to golf. And again, it's that fascination where there's a professional that has a small component of retail. And so it was to see, could we unlock the pro shops of golf courses? And so the beginning of 2017, we signed up 35, 40 golf courses. And then at the end of it, they churned just as fast. And so we sat there at the end of it, 2017. Okay, well, what do we do now? Is really one of our business advisors who had just left his optometrist to not only purchase his contact lenses, but his daughter's contact lenses with Clearly. And so it was him who really said, maybe there's something here that we could take the optometry industry. So we worked all 2018. We approached 4 optometrists, one of them being my own practitioner. We grabbed the 25 patients, friends, family, patients from those practices. And really it was to try and understand, you know, how does a patient want to order from their practitioner? If it was a dashboard, for instance, you know, we learned that moms do most of the ordering for everybody in the family. What would they want to see in their dashboard? And then from a practice perspective, where can we kind of automate certain tasks. And the way that I like to look at it, with my background being CRM development, you've got your first level support that you kind of automate that. And when that automation does the work, you kind of bump that up to a second level of support. And so that's what we tried to look at with Sightly. We did a soft launch in 2018 with those 4 partners. Worked really well. And then we approached the Ontario Association of Optometrists in 2019. And around that time, the college was in a legal battle with Clearly. And so it was kind of an easy approach, saying, I think we have something here that might solve this problem, as opposed to going down the lawsuit route. Because to me, again, when I look at it, it's the customers or the patients are clearly saying, I want to be able to do business this way. And the lawsuit really isn't, you're not going to solve that problem, because the market is the market, and however they choose to do business is how they choose to do business. I think what you want to do is you want to be able to give the market the tools for choice. And so there were 2 gatekeepers we had to go through. One was responsible for policies and procedures. She really liked the platform. And then the other one was Dr. Jeff Goodhue that we had to meet. I'd known about him, his technical prowess and his background. And so when we approached it to them, when him and I finally met and we showed him the platform, I don't want to put words in his mouth, but I think he was pleasantly pleased. And, one of the things he said is, I've been trying to do this for myself for years, where I can control the product, I can control the pricing, I can set all this information. The automated reminders go out, the automated text messages go out. And so what started off as contact lenses has really grown into contacts, dry eyes. Even in Calgary, there's 2 ladies that have a practice that put a full makeup line on their storefront, which I love, right? Because you may capture non-patients purchasing those particular items that then you can upsell your other services to. So we went to the symposium in 2019 with 4 practices. We came out of that. We signed another 6 at the symposium. Jeff and Tina, they opened up their network. We got, I think, another 10 or 15 practices out of that. Then we met I Recommend, did a partnership. And anyways, long story short, before the outbreak, I think we were at about 55 practices. Now we're over at 100 practices. And from us trying to figure out, just trying to create some tools to really help everybody get online as quick as possible, to let everybody know. And again, what I talked about earlier, we don't want that behavior to get set that, I have to go to Clearly or I have to go to another online retailer to purchase my particular items, because in this the outbreak and the social distancing, I can't go to my practitioner. And we certainly want that. No, you go to your practitioner first. And that's where your journey should start. And so we're hoping that that's kind of what we've been delivering with the platform.
Great. Thanks, Kelly. And you're right. You're a very practice-orientated business, and you're all about driving back to the practice. So just so you know, lots of comments coming in. Love it. Keep them coming. We will try to get to some of them. I think we're going to answer some of these questions in the questions we're already asking panelists, but definitely we'll get to some of them. So keep them coming. I'm going to head over to Kim, and we're going to start a little bit with some individual questions. So Kim, I know that Downtown Vision is, known as one of the best contact lens practices in Canada. I used to be your contact lens rep like eons ago. And so very familiar with Kim's practice. And you were one of the first adopters of an e-commerce solution. And I'd love to hear how you got started, because it wasn't because of this situation, and what you're doing about it, and how you drive and people to utilize that channel.
So I had always wanted to be able to offer the convenience of e-commerce for our patients, but it's just impossible for me to try to do that on my own. I had contacted some different web developers, and it just seemed like I just couldn't do that on my own. And I was at a meeting last January, and at a roundtable discussion, and Jeff was there, and he mentioned Sightly, and this is amazing. I was so excited. I immediately contacted Kelly through his website and was just so excited to get it launched. And so he started working on getting it ready for our practice. And we launched it in May of 2019. We had our first patient sign up on May 15th. In our practice, we let people know about this through our website and sent out emails to patients to let them know that we have this online store. And then in the office, when anybody calls to order contact lenses, we direct them to our fabulous, amazing contact lens assistant, who has just taken total ownership of Sightly and is an expert on Sightly now. And she explains to them that we now have this online store, which is offers them, secure online payment and direct shipment to their house. And she starts their account for them and signs them up. And even if they're too busy that day, maybe they say, oh, I just want to do this by the phone right now, I don't have time for this. We still try to register them for future orders. So get them, because there's lots of advantage to that, which I think Kelly will probably speak to, in terms of getting them reminders for future orders and reminders for even appointments too. And in as far otherwise as in the exam room, sometimes patients might say, oh, I have enough contacts to last another few months. Maybe I don't need them until the summer. Then I always invite them. I tell them about the store. I tell them about our online contact lens store. I bring them out to our assistant and I have her, get them started with an account so that they can, have that ability to order them online in the future. And same, if patients say, well, I just order my contacts online because it's easier, I just tell them that we have that option for them now. And usually they're quite happy to give us the business. So it's worked out really well. And I think patients just really like the convenience of being able to order them from home.
Yeah, I'd also like to say too that, they've been the most successful. So they crossed 100 orders in January. It was kind of this mini victory for all of us, if you will. But one of the things they've helped us develop is what we call the Sightly Playbook. And so that's, we've really tried to document their whole process that Kim just described so that we can share that, with the other practices that come on board and start, what does that flow look like throughout their practice to let the patient know about it, to try and get them signed up. So we've actually documented that in many conversations with both Kim and her assistant, what that flow looks like, and Jeff and Tina, and really tried to come up with what we call the Sightly Playbook, so that when you do get a storefront, it's not like, well, what do I do now? It's really trying to share the best practices of what you've seen from other partners of how they're moving their storefront throughout their practice. So I just wanted to add that because both Kim and Jeff and Tina have been really valuable in that, and of course Kim's staff in creating that playbook for everybody else to be able to consume and figure out what's the best way or what's the best path for Sightly in their storefront or in their practice. Sorry.
It's so true, Kelly. Like the one thing, no matter whether you're building Sightly or any e-commerce platform, the thing that people have to realize is that you can't just build it and people will come. You have to put a plan behind it, marketing behind it, strategy behind it to get people to utilize any platform. So it's really important, to look at the strategies that these guys have created. I'm going to move to Jeff. So Jeff, for those of you who don't know Dr. Jeff Goodhue, he is one of the founders of the Canadian Dry Eye Summit, and unfortunately, their Vancouver event in May had to get canceled because of this, but they have one in November and highly recommend it. Exceptionally good event. And Jeff is not just a business guru, he's certainly one of the top dry eye gurus out there. And I want to switch a little bit about how you're using this for products as well.
So we've been using Get Sightly for about 6 months right now, but for about a year before that, we were helping Kelly sort of develop it and tweak it. I think it's really important to remember that Get Sightly is not just purely a contact lens platform. It's much more than that. It truly is a very robust e-commerce platform, say like WooCommerce or Shopify. You can really sell any product that you want in your store, which is great. And I think the dry eye products that we recommend in our practices day in and day out are perfect to put up on the store. So when we put our dry eye products up, the intention was to sell to our patients, give them the convenience to reorder when they want to. But what's happened is patients from all across Canada have found our Sightly store and have bought dry eye products from us. We haven't advertised it. We haven't put any money behind it. They've just stumbled upon it and they found it. So we're shipping drops to all 10 provinces. That's probably going to drop off when all the nice folks that are watching this Facebook Live fire up their stores with Kelly's help over the next month or two, which is fine. I shouldn't be selling drops to Surrey and to Victoria and to Halifax. You guys should be doing that, not us. But what we've learned from that is patients are ordering at 11 at night, 12 at night. They're paying, a premium for 1 day shipping because they want their one bottle of eye drops. So it's not always about price; it's about convenience. And the dry eye products, it's been amazing, not only for our patients but for other patients across Canada.
If I could too, so we've got a really, when we're doing the demos, we've got a slide that I leave everybody with and say to them, if there's any slide that you take away from this presentation, it's the order pattern that we've seen throughout the platform. And you got to remember, like, really the platform, even though Jeff's been on it quite a while and Kim's been on it quite a while, really it's been a short lifespan, if you will, for the software. And what we've seen already is that 22% of the orders are happening before 9 a.m. and 28% of the orders are happening after 5 p.m. So 50% of the orders are outside of business hours with your existing patients. And so before the breakout, I would always ask and leave the question is like, when does the phone stop ringing? And now we're in this pandemic, we're in this social distancing where offices are closing. If we're already seeing those kind of stats and the remaining 50% was over lunchtime, what does it look like when we're out of this? Because this is what we are seeing prior to. And to Jeff's point, like even those orders outside of the other provinces, it is all about convenience. Even when we worked with all of those patients early on and would ask them, is it price or convenience? Price was never first in the questionnaire. It may come in second, it may come in third, but convenience was always amongst, and again, the sample size isn't large, so I don't want to make it sound like we did this 1,000 person survey, but the fact that it was consistent across all of them. And then when you start to see the data kind of back it up, where you see the ordering outside of office hours, where you see Jeff and Tina's store gathering, capturing orders outside of province. At the end of the day, it really is about that's what I call the speed to convenience. And yet you have to have some sort of solution to be able to offer that, because you do have those buckets of patients within your practice that's what they're looking for.
I'm going to come back to you in one sec, Kelly, with some more questions here, because we're getting a lot of kind of technical how-to questions. So I'm going to come right back to you. And I wanted to also throw this out is, Marketing for ECPs, we're a Google Premier partner. So we work very closely with Google. And we were talking to Google last week about what's happening on Google during this, pandemic in our field, in eye care, eye health, eyewear. What are those searches looking like? And the interesting thing is that they said not only are searches not down, they're up. It's because everybody's at home, people are online, and so they're seeing searches even for optometrists and eye exams still up. This is why I know it's a time you're closed, but pulling all of your marketing right now is not necessarily the best thing. And I want you to realize that, that people are looking for your services or are looking for maybe future services right now. And so important to keep, some type of online presence really going. So Kelly, okay, so we're hearing a lot of good stories, lots of great comments coming in. It's clear that Get Sightly could be an opportunity for people to build an e-store. We're hearing things, and I'm just going to give you a few to answer. Is tell us a little bit about like setup. How quick can you get set up? What products can you sell? What are maybe some of the challenges? What are some of the easy things about Get Sightly?
Yeah, so from a setup perspective, it's really a three-pronged approach. So we look at it, it's like it's your products and your patient. And so what we've done is we've curated the manufacturer's products. So from that setup standpoint, we actually send you a spreadsheet with the product information, and then you just really fill out the matrix, and that's what we import into your storefront to get started. Then the second step is we've got a couple of email templates in a Word document that we'll send you to really craft the messaging so that it's around your practice. Thirdly is we've got a document that will go to help you set up your Stripe account. So Stripe is the payment gateway that Sightly uses to capture that payment online. That's the same gateway that you see with Shopify or any other of the large commerce platforms. The reason why we've chosen is twofold. Is one, from a developer's perspective, from our team's perspective, they're probably the easiest to work with, we find. But if I put my business hat on, there's no monthly fee for that gateway if it just sits there. Whereas PayPal in the past, I don't know if they still do, but in the past there was a monthly fee. Moneris, again, when we worked with that gateway, there was I think it was like a $75 fee. Whether that's there or not, I don't know. So those are the two reasons that we've done that. So that's the third part of the setup is to do that. And then once that's done, it's really talking about how do we want to get the information out to your patient base. So with Sightly, we can actually import your patient data, and then there's an email engine that will send out invites. You can build up the profile of your patients, so the products that they are assigned to them. And the system will automatically email out those patients that, hey, we've got this storefront, which is kind of the playbook that you would see, really, talking about how Kim and her team have done it, is that, all you have to do is just create your password and everything's there for you in your dashboard, and you get those auto reminders, and whether you go to the storefront, whether you download the app, there's all of these different channels that we've tried to put in place to make sure that we capture that order for that practitioner as opposed to going online. And then, as Jeff said, we've done other things. So one of the areas that we looked at again was trial tracking. And so again, this was an area where we saw a lot of time being spent, staff members putting in that trial tracker, that trial follow-up either in a Word document or a spreadsheet. And so because we had the reorder reminder engine, we thought, well, we can put a reminder against trials. So what we found is that it works well for that experienced contact lens patient that maybe you're not going to recall back into your practice, but you still want to follow up with them. You'd like to give them an easy way to reorder their contact lenses. And so you can create that in your Sightly admin panel and have that reminder go out. And then you can craft a series of questions. You can pre-can a series of questions and then contextually add the appropriate question to the patient. And those are what get sent out. And then based on those answers, you can choose to either send them a purchase link, or right from any record within Sightly, you can call. I mean, calling the patient's always an option. But from within Sightly, you can send them an email, you can send them a text message, or you can send them a notification push through the app if they have it. So we've tried to just go beyond kind of that, as Jeff alluded to earlier, that the contact lens product, and really just leave it up to the imagination of the practitioner and their practice. And I mean, you can go as long tail as you want on your storefront. It doesn't necessarily have to be optometric focused products. It's completely up to you what you want to do with your storefront. So, and from a setup perspective, every practice gets their own database and gets their own storefront. So it is your data. It is your storefront to do whatever you want to do with that storefront. So if you look at Kim's storefront compared to Jeff and Tina's, they're different. I mean, sure, they've got some of the same products in there, but the way that the pricing structure and what do they want to sell, all that is completely different, towards their practice. And so those are just some of the things. And then from a future standpoint, I know Jeff and I have debated this quite a few times, but we want to be able to do the augmented reality, same thing that you'd see in a Warby Parker. I mean, we already have the app. It's nothing for us to be able to do that augmented reality piece. Video chat to be able to do that appointment. So if you look at the platform, if Sightly is also considered a communication tool, we want to be able to put those things in the platform. So they're all looked at in our roadmap. And then the last part, especially during this this situation we're in now, is ultimately be able to, when the practice approves the order, be able to push that order right to the major brands. And you know, I'm happy to say that Labtician is the first one that's worked with us. So now any Sightly storefront that orders or sells a Labtician product, we can now push that order right to Labtician, and they're going to ship it right to your patient. So there's some really, you know, there's some great things happening, you know, that were always part of our roadmap. And I just think that, you know, the pandemic and everything kind of accelerated a lot of things.
You're kind of pushed into a few things now. Hey?
We're pushed into a few things, you know, having developed some tools.
I'm gonna jump over to Tina. Tina, you know, I do want you to answer, you know, how, once you launched an platform, you know, how did you get it going and everything? But before you do, there's a couple questions, and I thought you're perfect to answer this. Is people are asking, you know, when the order comes in, what happens? And they're also asking, like, you know, who pays for shipping? Can you ship it to the practice? Can you ship it to the patient? What's happening? So, Tina, can you answer that?
Yeah, so when the order comes in, right now it's not as seamless as you know what Kelly was alluding to. What we'd love to see is it go directly to the company and they ship it out to the patient. So right now, unfortunately, it doesn't quite work that way. We get the order, we have a dashboard that we look at daily, and we can see what orders have come into our practice, and we actually have to then process the order. So that means that if it is a contact lens order, we will phone the company or email or you know, e-order it from the company and have it sent directly to the patient. If it's a drop or a product, then we actually do just physically take it from our inventory, package it up, and mail it out. So right now, there is a little bit of behind the scenes work that has to go with owning your own store or web store.
Then what about checking to see if the contact lens prescription is valid?
So that's something that I guess later on I had said there was one point I wanted to make, and that is that as an owner, you are completely in control of whether you process an order or not. And what that means is if someone orders contact lenses, but you notice that they haven't been in for an eye exam in over 3 years and their contact lens prescription is no longer valid, you don't have to fill that order. You can simply reach out to the patient and say, you know, unfortunately, your contact lens order has expired or your prescription's expired, and we need you to come in person and see us before we can fill the order. So I think that was one of the questions that popped up on the side is, you know, how do you take care of that? So you can have a very professional site. You're not just carte blanche filling every order. I think there was another question that you asked. Oh,
so, yeah, so like things like, you know, what did you put in place, you know, when you launched it, procedures, staff training, scripts?
Right. So like with any new program that you launch in your practice, you have to change your staff's behavior. And in order to do that, we had to come up with scripts and protocols. And what I've learned from the past is you always have to develop them with your team. You can't just dictate to them, this is what I want you to do. You have to sit down and decide all together what's the easiest approach or how do we manage this. Like Kim said earlier, what we decided to do was for every patient that a doctor was seeing, and especially if they were a contact lens or dry eye patient, we let them know that we now had this web store. And for every patient that had done a contact lens order and was just coming in to pick up contacts, on their pickup, we let them know again that we had this store, and the next time they could simply you know, go online and order their contacts without physically having to come see us. And we set up, you know, sort of, like I said, the protocols to do that within the office. And still, I found in the beginning, the uptake was a little slow. And part of that was we would just forget sometimes to mention that, yes, we have this online web store, or sometimes we'd run out of time or the patient was in a rush and we didn't have time to actually get the words out. So what we ended up doing was having an internal contest with the ODs to get as many patients signed up as possible. So the OD was responsible just for talking about the store and letting patients know it existed, doing the handoff to the staff, and the staff was responsible for actually registering the patient. And I'm going to say that really kickstarted our whole process. And of course, there were prizes for those that won. Yay!
I'm disputing those results as we speak. She's not
That's
competitive.
awesome. I love that.
That's it. And I should just make clear too, when you sign patients up to the platform, there's actually 2 ways that you can do that. You can register them in your office fully, or you can let them know about the program, send them an email, and have them register themselves when they get home. So if you're, in a bind for time, then that's the easiest way to go. However, I will say that if you can register them in the office, the uptake is much better. If you send them an email and have them register themselves at home, I'm going to say it's probably 50-50 as to whether they complete the registration process. The reason you want them to register is because now you can go in and assign their products to them. And so what that means is when they're ready to order, they simply get an email stating, pardon me, I should go back and just say that Sightly will send reminders out to patients at about the time they're ready to run out of their contact lenses to let them know that they're going to need to reorder. So an email will come in, they'll see the email, Sightly will say, according to our records, it's about time that you reorder your contacts. Would you like to reorder? And there's a button there that you click, and then a screen pops up and it says, do you want 6 months or do you want a year? And they click another button and boom, it goes to their shopping cart and they're done. They haven't had to search for a website. They haven't had to search for their products. They haven't had to enter parameters. It's all set up for them. So in terms of any e-commerce platform, it's one of the simplest and easiest to use and very convenient. One of the other things that we did, Trudy. One of the other things we did in our practice that helped sort of just to get awareness of using this platform out was to have little stickers that we put on our contact lenses or contact lens boxes when we dispense them. And the little sticker has an R or an L, so you circle if it's a right or a left eye. And on there it says to reorder your contacts, simply visit us at, and then it has our web store listed there.
Cool. Great info. Kim, I'm going to ask you this question. Kind of interesting. It's a little bit based on some questions that have been coming in, but, one, are you getting outside patients coming to your platform, finding it through your website, and ordering? And how do you handle that? And another question is, can they register on their own at home? If they haven't registered being a patient, non-patient, and then how are you verifying prescriptions?
So we haven't had a lot of outside patients. Not that I think just one since we've been closed now, but we haven't had that happen. We've just had our own patients. So we haven't really had to deal with that yet, or how we would deal with that. But I think you would just deal with it the same way you would have anytime a patient who wasn't from your office wanted to order contacts from you. But we haven't really had to deal with that yet. And then what was the second part of that?
Can they register from home was a question,
Yes.
like if they haven't registered.
Yeah, so I think Tina was mentioning, they can just register. They can click on the link that goes to our Sightly store, and they can just register to become a patient to be able to order. When they do that, they have to set up their account just like you would with any online ordering. If you're ordering, the first time you order from Amazon or something, you have to set up your account. What we like to do when we were open is to help patients and create their account. So my assistant, our fabulous contact lens assistant, would go in and basically create their account for them, put their name in, their shipping address, assign them their products. So it's all ready to go. And then Sightly sends them a link, an email to just register and basically pick a password. And then everything's already set up for them. So I think if you can provide that convenience for patients, that's great. It just makes it just easier for them to use it, and it's just simple. They just really have to do one thing. But they can just start from scratch and register themselves.
Okay, so question for all of you. Anybody can answer, all of you can answer. We did hear the one, a tip about a supplier, and that's Labtician, being able to ship directly from home. What other supplier partners are kind of offering help right now? What else can supplier partners do, to help with e-commerce and help practice with e-commerce? Any?
So I think we've talked a lot about this direct ship to home. So prior to this outbreak, it was either a 6 or 12-month supply typically that were direct shipped for free from the contact lens companies. But now it's all quantities are being shipped free to home from Alcon, J&J, Bausch & Lomb, and CooperVision. So big shout out to the contact lens companies. I know there's a lot online at the moment, so thank you for doing that. Labtician, this again, that's news. That's great, Kelly, that they're going to ship direct to home. iMed Pharma announced last week that they're going to ship direct to patient as well. So all of these, things are great. Suppliers can also, they've also offered incentives when we first launched Sightly to get patients to sign up. So whether it's reward points through the system, so you can spiff your patients, you can give them reward points within Sightly. You could say, for every $100 you spend, you get 500 Abbey Eye Care points. You can completely control that, how many points per dollar spent, what the value of that currents, what those Abbey Eye Care dollars all are, you're in complete control. Co-op dollars from the suppliers would certainly help. And also, the more we can integrate with the contact lens company. So when a patient comes in and wants to order their lenses, we make sure that their contact lens prescription is valid. If it is, when we click order, it'd be nice if it then went to the contact lens supplier. But the key, and Kim talked about this and you talked about this, Tina, it's up to the doctor to approve the order or not. But once you approve it, if it can just seamlessly get sent to the contact lens manufacturers. So all the contact lens folks out there, hopefully you'll reach out to Kelly or whatever e-commerce platform is out there and build these connectors to make this more efficient for everybody.
And also, Trudy, I want to say that when it comes to the ordering process and payment, the storefront doesn't capture the payment until the doctor or the practitioner actually goes in and approves the order.
Yeah.
And so I think there was a question there if it was a net new patient or anything like that. To me, again, when I'm kind of standing on the outside here because I'm not a doctor, to me, I think that's a great thing. So if anybody comes to my storefront and orders product and all I'm taking is the credit card, but I have to approve the order. If that's a net new patient, that's an opportunity. That is somebody who said, I want to do business with you. Now the question is how do you get to finish that purchase journey? And so with Sightly, again, you can put the order under review. And because you haven't taken any payment, now you have the ability to communicate with that patient and say, hey, listen, you're new to the practice. We need you to come in, or you need to fax your script to us or whatever. And as I say in my demos, well, what if they don't get back to you? That's okay, because you can just go into Sightly and delete the order. But you know what you got out of it? You got some marketing information, because they had to create an account to actually get that far. So you could, future market to them or to do however you want to handle that. So most importantly for Sightly is that when it talks about your control of the order, you actually don't take payment until you've actually validated that order. And that's when in Sightly you go process payment. And that's when so I just wanted to throw that in there from a payment perspective. It wouldn't matter who came to your storefront. I think it's great. Let everybody come to your storefront. Let everybody order whatever you've got there. It's up to you to decide whether or not you actually want to fulfill and finish that order.
Great. Thanks, you guys. We're down to kind of our last few minutes. It's amazing how fast an hour can go, hey? We have had a couple of questions about selling glasses, and, I know, Kelly, you did talk, and you guys talked about the fact you can put frames and sunglasses on there right now. We've been getting asked about full service solutions. And so we are actually going to post an ebook. I was going to say it at the end, but I see questions coming in. So Marketing for ECPs has put together an ebook that talks about all solutions that are available in e-commerce, just because we don't want to sound too biased. We love Kelly, and that's why we're here supporting him today for sure. And the other thing too is, this is a Canadian solution that is robust and can, get up and running quickly. So that was another question. Kelly, number one, we're getting asked, what is the cost? And also, how quickly can you get an e-store up in these days?
So yeah, so we're trying to get everybody up and running in 3 to 5 days. And like I mentioned from the top, we've got a great partner in Microsoft. So all of the storefronts are hosted in the Microsoft cloud, if you will. And so they've really, with our developers and their developers, we're just finishing some tools that we can actually have a storefront up and running in 5 minutes, which is incredible for the volume that we're getting. And once that storefront's up, then it's just finishing off products and what have you. So we're really trying 3 to 5 minutes to get everybody up and running. And then from a cost perspective, so it's a $249 setup. And this was, so I'm going to give you the cost prior to the outbreak and then what we're doing where we're at now. So it was a $249 setup. You get 2 months free, and then it was $129 a month billed on an annual basis. But because of the breakout and not sure when we'll able to open our doors, what we're doing is it's $249 setup, 3 months free, and then we won't start the billing until after the 3rd month, the free period's up. And so we just think that should give everybody enough time, inexpensive way to get going, gives you the free period for we all can get through this. As one of our storefronts, Marivelle Vision Care, their discount code is in this together, which I love. So we're trying to do our part too, just that setup fee, and then we'll worry about the rest in 3 months when, hopefully we're all out of this situation. Our doors are back up and running and we're figuring out what our new norm is. So that's what we're doing for everybody right now. And I think lastly, to your last point, obviously we'd like it to be Sightly, but I will say that as an e-commerce lover of the platform and that whole idea, I think you should get any e-commerce solution, whether it's Sightly or whatever, because when we come out of this, anybody that has a small component of retail, you are absolutely going to need an e-commerce solution, whether that's Get Sightly, whether that's Shopify, whether that's, one of those other ones. Obviously, Sightly is geared towards the optometry industry, but I just think that you've got to have some sort of solution when you come out of this. This has to be one of your top priorities going forward, in my opinion. So, I'm going to tout Sightly, but I think it's important and imperative that you have something when you come out of this.
I know Kevin just posted that we do have some resources, which is going to include this, recorded version of this webinar. If you came in late, you're going to be able to go back and watch it. Please do head over to Marketing for ECPs for a lot of different resources. But I want to thank you, Kelly, for, in this time and everybody gravitating towards you for, this type of solution. You could have taken advantage, and in fact, you're giving back. So I think that's really commendable. And we're going to wrap up, you guys. And I want to wrap up with something inspirational from each of you. Nothing related to e-commerce. Let's just give everybody a success tip in how to move through this right now. And let's start with, Jeff and Tina.
Well, I guess, that this crisis is creating we knew optometry was under pressure, from all different forces even before the crisis, but now this is kind of a seismic shift that's happened. So I think people, we're so lucky to have met Kelly and made that connection and had our store up and running. But yeah, it's super easy to get set up. Don't hesitate to reach out to Kelly. He'll get you, get your site spun up super quickly, because you need this solution, because your patients, they're going to need to order right now. And if you, if you want to retain those patients, you need to offer them something. And I've been trying to do this for years on my own, like WooCommerce, Shopify, technically possible, but really difficult to work around the contact lens piece. So it's nice to have a sort of a eye care practitioner focused platform.
Great. Kim, you want to jump in, give somebody a success tip for your practice is not unknown to crises. How do people navigate this?
I really, I just think just take it one day at a time. And we have this time right now. It's not something we wanted or planned for, but we do have this time to investigate solutions like, that Kelly offers, and to investigate other things that might work really well in your office for, how things will be when we reopen. So just take it one day at a time, and just, I just putting things on my to-do list and just trying to work through them with this time that we have right now.
I've said it's busier now than it was
Mhm.
before this happened.
It feels like it for sure.
And I don't even have a commute anymore. Kelly, a success tip to share with people.
I was talking to a colleague yesterday. I think she said it best: is just don't be a speed bump. You know, don't lie there and let kind of this all go by. We got to be patient, but you also have to be proactive. And again, I can only talk from the storefront perspective. But if you've always wanted to do a storefront, now is probably the time that you should probably act on doing those things and be proactive and not reactive. And I think that's where, again, you know, Jeff, Tina, and Kim being proactive are where they are today. And nobody foresaw this. Nobody foresaw this happening. But certainly I've seen the activity on their storefront, and it's still just as busy. And I think some revenue is better than no revenue. So I'd say don't be a speed bump. You got to be proactive. And if you're going to do it, then just do it.
Yeah. Okay, I'm going to share a last tip. And I'm stealing this from my business partner, Kevin, which it kind of inspired me to think differently this week. And, you know, he said, you know, the last couple weeks we were in the defense mode, and every day was defense, and, you know, figuring out daily how to save things from our business. And he said, you know, this week now we have to go on the offense, and we have to figure out how to move better, shift, adapt. This is going to be a different world. Marketing is going to be different in the future. The people we work with are going to be different in the future. So, like, how do we move through and be offensive right now? So, on the offense, and yeah, offensive. I think, you know, it's pretty important for everybody to shift, adapting, and moving right now. So, thank you, everybody. Thank you, panelists. Appreciate it. Again, if you arrived late, this will be recorded. You can come back to the For-ECP's Facebook to listen to it. It's going to be on our website. And we've got more coming this week, so please join us. And thanks again. Thank you, everybody.
Thank you. Bye.
Bye.
Bye, guys.